First, I will explain about programs that bring benefit for senior citizens and medical treatment care. This campaign is administered by Ministry of Public Health, Housing and Local Government of Sarawak. The Senior Citizen Health Benefit (SCHB) is targeted public health initiative launched by Sarawak Government in July 2022. It was introduced in response to the growing healthcare needs of the aging population, especially among economically disadvantaged senior citizens. This benefit also initiative senior citizens to access complementary medical care as the number of senior citizens in Sarawak continues to rise, with over 75,000 aged 60 and above reported in 2023. The need for accessible medical care and affordable medical treatment. The SCHB program aims to reduce inequalities in healthcare access by offering an annual healthcare subsidies of 500 ringgit per eligible for senior citizens. This initiative not only reduces financial stress but also encourage yearly diagnosis and consistent medical checkup, contributing to improve public health outcomes in the long term. It is part of the broader government strategy to prepare for Malaysia transition into an aging society. Next, I will explain about the policy problem. There are several key challenges and policy gaps that have been developed for senior citizen health benefit. Most of the key challenges is limited social protection for senior citizen individuals, particularly from low-income families, lack comprehensive social protection without sufficient saving, pension, or family support. The cost of medical treatment become a heavy burden because the report has been found that senior citizens, mostly from B40 and M20, are poor region and limited assistance. Next is inadequate healthcare facilities in rural and interior region in Sarawak often suffer from limited access to healthcare facilities. There are few clinics for long travel distance and inadequate public transport options which prevent seniors from seeking timely care. These challenges may be critical because transportation issues. Next is digital barrier as healthcare services increasingly shift online. Many seniors find it difficult to navigate digital platforms due to low digital illiteracy. This limits their ability to apply for assistance or book appointment. This becomes challenges cause of postponed treatment and poor health outcome. Next is for the overall delay or avoid medical care due to financial transport or digital barrier. Many senior citizens postpone or avoid seeking treatment, which can lead to worsening health condition and higher long-term costs. These key challenges are highlighted due to prevent senior citizens seeking for medical care, or it can become worse for their health.
There are 5 objectives, which are equitable access to outpatient service. Second one is financial relief through subsidy. The third one is promotion of preventive healthcare. Fourth, reducing burden on public clinic. And the last one is community empowerment. The SCHB program aims to improve access to outpatient healthcare for seniors, especially in rural and underserved areas. By partnering with both public and private clinics, it provides an annual 500 subsidy to ease financial burden for basic medical care. The program also promotes preventive health care through regular checkups, helping detect conditions like diabetes and hypertension early. By shifting some demand to private clinics, it helps reduce overcrowdings in public facilities. Community leaders play a key role in raising awareness and verifying applicants, ensuring strong local engagement and participation.
Next, I will explain about the strategy in the senior citizen health benefit is implemented using a well-structured public, public-private partnership PPP model supported by a digital administration system and community verification methods. This strategy allows senior citizens to fulfill the Sarawakians' qualification requirement and access senior age 60 years and above who are Sarawak residents can access services at approved private panel clinic without paying upfront as long as they are verified as low to middle income earners. In addition, to improve the healthcare and service efficiency. Second strategy is community-based verification. Applicants must present their MyCard and income status with confirmation from local leaders or village head. This process ensures that aid reaches the right people and disadvantaged senior citizens, especially in areas where formal documentation is lacking. For the third strategies, digital system via Service Sarawak, the entire process is digitized using the Service Sarawak platform, which facilitates online application, real-time tracking of subsidy usage, monitoring to remaining balance, administrative transparency. Fourthly is targeted outreach. The government use local media, community centers and religious groups to inform and educate seniors, especially those with a lack of limited digital access or mobility. These strategies can be useful for senior citizens to know about seeking medical treatment in application and knowing more about useful gadget. Lastly is in partnership with 88 private clinics across Sarawak, joint senior citizen health benefit panel by Dato Sri Fatimah Abdullah. This is to ensure senior citizens can receive medical treatment for fever, cold, headaches, diarrhea, vomiting, sprain, skin allergy and light irritation, and also gouts, as well as light wounds, and some of them are requested from senior citizens, and the situation also changed to dental treatment. Governance and funding. The program has been managed by Ministry of Public Health, Housing and Local Governments, which is focusing on level health and welfare objective and wider public health. Framework Sarawak State Government has allocated 50 million ringgit Malaysia to sustain implementation for senior citizen health benefit at year 2025 and to support up to 100,000 senior citizen families and panel clinic. Next is a legal requirement for community verification. Best verification is legally mandated, requiring local leaders to confirm their application and eligibilities based on income. This system builds trust but also introduces variability in how strictly it is enforced to become senior citizen. Next is a digital governance and data security. The platform also operates under data protection policies, ensuring the security of personal information and proper data usage and administrative accountability. To become senior citizen health benefit can facilitating efficient supply of service to seniors across Sarawak. Next explanation is about strength. First strength is promotion of health equity. The senior citizen health benefit initiative significantly contribute to promoting health equity by prioritizing elderly individuals from low and middle income backgrounds. This approach reinforces the fundamental notion of healthcare as universal rights. By reducing economic barrier, the program ensures that senior citizens, particularly those in underprivileged or rural communities, receive equitable access to essential healthcare services. For the second strength is improve healthcare accessibility by incorporating private healthcare facilities into its delivery framework. The Senior Citizen Health Benefit Program enhance service accessibility for senior citizens. This model minimizes the needs for long-distance travel and decrease associated costs, especially for individuals residing in geographically isolated regions. Consequently, it facilitates more convenient and timely access to outpatient care. For the third strand is facilitation of preventive healthcare measure. The allocation of yearly 500 ringgit healthcare subsidy serve as a proactive incentive for the elderly senior citizen to engage in yearly medical consultation. This mechanism encourages the adoption of preventive health practice, thereby mitigating the progression of minor alignment into more severe medical condition. Over the long term, such an approach contributes to a reduction in overall healthcare expenditure and improve health outcome. The fourth strand is integration of digital governance tools. The utilization of digital platforms such as the service route system enhance administrative efficiency, transparency, and accountability in program implementation. These digital tools streamline data management, beneficiary verification, and subsidy tracking, enabling real-time policy evaluation and facilitating evidence-based improvements in public healthcare delivery. For the last strand is strengthened community-based outreach. A key features of the Senior Citizen Health Benefit Program is reliance on community-level network, including local leader and grassroots organization to facilitate program awareness and beneficiary registration. This participatory strategy enhances community ownership, ensure more accurate targeting of eligible reception, and fosters stronger government-community relation, particularly in rural and
The weakness and challenges. Insufficient funding. 500 ringgit annually may only cover basic service. Senior with chronic diseases or frequent medical needs may find this amount inadequate. The second one is digital divider in elderly citizens are not familiar with online system. This limit access to service and reduce program effectiveness in remote communities. The third one is inconsistent verification standards since community leader verify income. Differences in interpretations or enforcement may result in eligible senior being overlooked or excluded. The fourth one is lack of specialists and inpatient coverage. The program only covers outpatient service. Senior needing hospitalization, surgery, or specialist consultation may pay out of pocket. Fragmented referral system without a formal link between SCHB clinic and government hospital. Patient may face delay when transitioning between basic care and specialist treatment. The recommendation is increase subsidy amount, raise the annual coverage from 500 to 700 until 1,000 ringgit, especially for senior managing chronic diseases like diabetes or hypertension. The second one is expand clinic network, include more rural and remote private clinic, and introduce mobile clinic to bring healthcare directly to undeserved area. The third one is digitize income verification, integrate SCHB with centralized income databases, for example, program eKase, to automate and standardize the eligibility process. And the fourth one is promote health education, organize awareness campaigns to educate seniors about the importance of preventive healthcare, lifestyle change, and managing chronic disease. The last one is introduce telemedic, provide online consultations service to homebound or rural seniors who face mobility challenges. The conclusion is the senior citizen health benefit is a thoughtful healthcare policy that supports Sarawak elderly through public-private partnership, digital system, and community engagement. While it brings clear benefit challenges like limited funding, digital access, and specialist care remains. With continued support and improvement, SCHB can become a model for elderly care across Malaysia, reflecting the state commitment to inclusive and equitable healthcare. Thank you.